like to welcome you all to tonight's Transplant Talk Live, Arrow Foundation's webinar series. We're very fortunate to be able to provide our audience with some fabulous content and topics, and tonight we're very excited to welcome a special guest who is going to talk all about the psychological impacts of stem cell transplants. So I am Angela. I'm the Patient Liaison and Communications Officer with Arrow, and I'm joining you today from the traditional lands of the Wadawurrung people in the Geelong region of Victoria. I have with me this evening our wonderful host, Yvonne Panic-Hudson, who is, amongst many things, a clinical nurse practitioner in haematology at the Peter MacCallum Cancer Centre and the Royal Melbourne Hospital. She's also the co-host of the fabulous and very informative podcast, The Straight and Marrow, and Yvonne is one of the directors on our Arrow board. She's joining us today from the traditional lands of the Wurundjeri people in Naarm, Melbourne. So along with Yvonne, we're very fortunate to welcome our wonderful and very popular panellist tonight, Dr. Phoebe Newman. She's a senior clinical psychologist working in private practice and at the Royal Melbourne Hospital, and she's in the area of psycho-oncology. She's also joining us today from the traditional lands of the Wurundjeri people in Naarm, Melbourne. I'm going to shortly hand over to Yvonne, who will be facilitating our Q&A, which will hold on the completion of Phoebe's presentation. So please, if you do have any questions, pop them in the Q&A section, or you can pop them in the chat section as well. We will be monitoring these questions throughout the session. I do need to let you all know that whilst we're here to provide you great presentations, we are unable to answer any questions that relate to your own illness or diagnosis, and we would request that you seek advice from your treating healthcare teams. So time is of the essence tonight, so without further ado, I would like to hand over to Yvonne.
Thanks, Ange, and thanks to Arrow for hosting these really wonderful, informative webinars. I'm quite overwhelmed by the number of people in our audience tonight, and also really delighted to see people helping one another with technical issues and that people were able to resolve them. So hop in the chat if you're still having tech issues, because there's some great advice there about using headphones and your volume. So look, everyone's here to listen to Phoebe. I'll be hosting the evening, and I'll be chairing the Q&A after we listen to the wonderful Dr. Phoebe Newman, who's a clinical psychologist at the Royal Melbourne Hospital, and who brings an enormous benefits to our patients in our transplant community, and she's going to share some of her knowledge and recommendations with you all tonight. Thanks very much. Thanks, Phoebe.
Thanks, Yvonne. I still somehow haven't gotten used to muting and unmuting myself after COVID. Hi, everyone. I'm really happy to be here with you all, and I hope that my presentation presents you with some helpful information. Just bear with me while I get that on my screen, and then we'll be off and away. Okay, so I'm hoping that everyone can see my presentation. Has that
That's good, Phoebe. Thank you.
Excellent. So yes, tonight I will be talking a little bit about some coping with some of the psychological impacts of BMT and stem cell transplant. And thanks for inviting me to the Arrow Foundation. I'm very passionate about this area, having worked with folks for some time at RMH, going through their transplant and also in recovery afterwards. So just a quick acknowledgement of country as well. I'd just like to acknowledge the First Nations people across Australia as the traditional custodians of the land upon which our hospitals, our transplant centres stand. I'd like to extend my acknowledgement to the Wurundjeri people of the Kulin Nation as the traditional custodians of the land from which I'm presenting from tonight, and pay my respects to elders past, present, and any First Nations people present today. So here's just a quick snapshot of some of the things I'll be talking with you about. So just a little look at some of the thoughts and feelings and experiences that people might have before, during, and after transplant. And with these things in mind, I'll also talk about some of the therapeutic approaches that might assist you or someone that you love. I don't know if we have any caregivers with us tonight in the audience, to help you cope with the stress that can come with transplant, or the unexpected things that can pop up across the way. So I'll spotlight a few different techniques, so cognitive behavioral therapy techniques, some mindfulness and breathing techniques, some self-compassion practice as well as some tips for caregivers and people that might be supporting their loved one through the process. And as Ange mentioned earlier, just a little note that all the things that I'm talking about tonight are just sort of general advice, and everyone has their own experiences of bone marrow transplant and stem cell transplant. And the presentation is really just designed to be general in nature. It doesn't constitute any specific advice, or it might not relate to your specific circumstances. So if there are any things that come up for you tonight, any questions that you have about your specific diagnosis or the side effects of treatment, anything like that, please discuss them with your medical team. So I'm just going to quickly go through some of the experiences that people might have prior to transplant. So before transplant, depending on how someone's come to be needing a transplant, there might already be feelings that they have about their diagnosis or their medical condition and what that might mean for them. It's common for people to report feeling overwhelmed or worried about their diagnosis. They might feel numb or find it difficult to feel like it's really happening to them, or that transplant is really going to happen. They might feel a bit of dread or anxiety about the next steps in the process. And during appointments, I have had some patients say to me that they're feeling quite flooded with information, almost like there's too much to take in. The information itself can be sometimes technical, or just so much to digest. And even with all of that information that's coming through, it can actually be a bit impossible to truly imagine what transplant is going to be like before you have the transplant. And the uncertainty about that, about what the transplant might be like or whether it will be successful, sometimes what that does for our mind is it brings up a lot of what if thoughts, what if thoughts about the things that could go wrong or the things that might happen that might be unpleasant. And our brains are kind of like scouts, they bring these things up to try and help us feel more prepared. But it's kind of impossible to be prepared for all of these scenarios, isn't it? It's not really possible to be able to make a plan for absolutely everything that could happen. And so sometimes we can get stuck in these thought loops about all of these what ifs that could happen. And we might try and find reassurance in different ways. Some people might consult Google or online forums. And sometimes researching can be helpful, but sometimes it can also make us feel more worried, or it might expose us to things that actually might not really happen in our individual circumstances. And so sometimes when we can't get that reassurance, the cycle of the what ifs continues, and we can start to feel increasingly more anxious and dreading what's coming up. And even with all of this preparation, sometimes people feel like it's hard to feel like they're really prepared for coming into hospital. So in a while, I'll just present some ideas and tips about what to think about prior to coming into hospital. And also just acknowledging that you might be concerned about who you're leaving behind when you go into hospital, you know, being worried about being away from your family, pets, and your friends. All of those things can kind of come to mind. So getting ready for hospital, it can help to just feel like you are able to take some practical steps to get ready for it. Some things you might like to consider might be when you're packing a bag and thinking about your hospital stay, just really focusing on trying to think about how to be as comfy as possible, and really thinking about things that might be comforting for you to bring in. So things like comfy clothes or pajamas, and having items that connect you, make you feel like you're able to think about people in your life that you love, your pets. Some people like having videos on their phone, so to try and deal with the downtime that happens in hospital. If you do have nice memories on your phone, that might be helpful. Hospital can also get pretty boring, as much as, you know, there's a lot that goes on in the hospital. You might also like to think about whether there's devices or books and things that might help you pass the time. And if you do want to bring in some headphones to listen to things, just a really quick note that try to think about things that won't easily get lost in the bed, because people can sometimes lose their wireless devices easily. So if you do want to bring those in, just maybe bring one with a cord or something that won't get easily lost. And trying to decide on a plan with your support network can also be a helpful thing to think about. So if there's a support person who you feel would be the best person to receive updates about your care, and maybe give those updates to the other people in your life, that might help you feel a little bit less burdened and feel like you don't have to constantly be responding to messages or taking calls when you're in hospital, because for some people that can feel like a bit of a pressure to keep people informed. And you might like to let family and friends know that you might not always have the energy to take their calls. And, you know, it's not a personal thing. It's just something that might help you to take some of the pressure off yourself. And also, it's good to have a discussion with family and friends before you come in about the fact that once you receive a transplant, you'll be immunocompromised after that time. And so anyone who'll come to see you will need to wear a mask. And it might seem like that's a pretty understandable thing. But I think it's always better to try and make sure that people are informed about that before they come in. And if they're feeling unwell, to maybe avoid coming to see you during that time. You might also need to communicate with your workplace or your other commitments that returning to work after transplant can be a bit unpredictable. Sometimes we don't always know the timelines about when we might be able to return to work. And having a chat to your work about this might make you feel a little bit more supported in that process, and hopefully they can let you know if there's any supports that they can have for you, or just what might happen with your role in your absence. You can also speak with your transplant coordinator about any supporting documentation you might require, or whether you might be eligible for any assistance that you might need. And discussing transplant with family, depending on your family, might be a bit of a consideration as well. For some families, everybody's pretty open. Everyone feels like they can talk freely. In other families, there might be worries about how transplant might be thought about by different members of the family. Will they get worried about me? How are they going to react? And if you have children, they might become curious or concerned about what it will mean that you're in hospital for an extended period of time. So depending on their age, you might need to modify the type of information, the amount of information that you're providing to them about hospital admission or about transplant, but helping to kind of give them some sort of preparation for the fact that you might not be around in their life in a way that you normally would be. And also thinking about other people in your life who might also be able to assist with care arrangements for dependent members of the family and pets. And that might involve including your family members in conversations with, say, social work or your patient coordinator, if there are things about your family circumstances that you think transplant might make even more stressful or hard to deal with. So it's important that kind of everybody's in the loop with what's going on. So during transplant, people might also experience a number of difficult things, difficult feelings. Transplants can come with a great deal of uncertainty. So there's uncertainty in regards to how transplant might make you feel or how you might respond to it. And sometimes that uncertainty can even be on a day-to-day basis. We don't really know how we might wake up and feel in the next day. And sometimes, particularly the early days of transplant, we don't know whether or not the transplant has been successful for some time, and it can require some mental stamina to remain, constantly centered and present when you're managing all of this uncertainty, because our brain doesn't really like uncertainty too much. Uncertainty tends to trigger anxiety. We tend to problem solve when we don't know what's going to happen. We try and think about all of the ways that we might be able to deal with that problem. And when there's no answer to that, we can kind of just be there imagining things over and over again. And so later in the presentation, I'll discuss some mindfulness strategies that might help us manage some of the impacts of uncertainty. And during admission, some people might also find it difficult to receive care from medical staff, especially if they're feeling unwell or in pain. If you're a particularly independent person or you're used to caring for other people, having that switch of having people now caring for you can be quite a big adjustment. And sometimes people find it hard to actually say how they're feeling or what they might need in order to make their care more effective. And people might feel kind of a loss of their own independence. And that can be confronting, especially when you're already feeling unwell. Your mood might decrease. You might be feeling frustrated or feel like there's a loss of motivation that starts to happen as well. And on top of that, hospital can also be very understimulating and boring, as I said earlier. People don't have the same access to things that they might usually enjoy doing, especially if you're a highly active person and you're used to, being out there and being on the land or being in nature. Being in quite a clinical environment can be quite a big change. And sometimes that people might not expect that there feels like there's a real loss to being able to be how they would usually be in their day-to-day life. And sometimes because of that confinement in hospital, people can feel a bit lonely, and they might find it difficult to be with themselves at the end of the day when visiting hours are over and your visitors leave for the day and you're on your own again. That can be a bit tough for some people. Some people love a bit of me time. So everyone's a little bit different, but for some people that can be tough as well. And as I've mentioned, just feeling unwell also generally has an impact on our mental health. And it's hard to continuously feel, upbeat and positive when, our whole body might feel quite exhausted and tired or in pain. And sometimes what our mind does with that is it starts to think about the future. And when we think about the future, really all we get is a reflection of where we are in this present moment. So if we feel bad in the present moment and we start to imagine the future, sometimes we start to imagine that the future's not looking so good because that's what we're feeling in this moment. So I might talk about some ways that if that starts to happen, we can address some of those thoughts and maybe try and change our perspective as well. So that brings me to an approach called cognitive behavioral therapy. So if people have been in therapy before, you might have heard of cognitive behavioral therapy. It's a pretty common therapy. It happens to be the gold standard for a lot of different mental health treatments. It helps people to cope with stress through identifying unhelpful thoughts and understanding how those thoughts might contribute to and interact with behaviors that aren't actually all that helpful. They might be maintaining the problem instead of solving the problem. And CBT can help, as I said, with a range of different things. So it can help with managing the thought loops that maintain anxiety. It might help to identify and modify the behaviors that are getting in the way of cutting through those thought loops that keep the problem continuing. And we can also think about how to adapt some more helpful ways of managing the problem. So CBT can also be tailored to address specific problems like anxiety, depression, insomnia, pain, and stress. Unfortunately, I won't have time to go through all of those things tonight because these are things that people might work on in therapy, for some weeks with their psychologist. But I do have an example of how this might work for someone in transplant. Going back to the earlier idea that I talked about of experiencing what if thoughts when we're dealing with uncertainty. This is the example that I'm using tonight of someone who's experiencing some what if thoughts during their transplant. So in CBT, this is what we call a formulation. And CBT formulations try and look at how when we interpret certain things that are happening, so we call that the stimulus, which in this case is someone feeling sick. We interpret stimulus in a particular way that can trigger unhelpful thoughts or beliefs that then impact our feelings, thoughts, and behaviors and kind of create this cycle that keeps happening. So in this example, the person in transplant has interpreted the feeling that they get of being sick as being evidence that perhaps their transplant hasn't worked. And in response to that thought, what if the transplant hasn't worked? They start to feel worried and panicked, like this is really what's happening. And because of these thoughts, they've gone back to their medical team, maybe even multiple times in the day, and they're saying, how do you know that it's working? How do you know that it's working? And let's just say at this point in time, their treatment team can't confirm whether or not the treatment is working. And so they can't actually guarantee to this person that transplant has been successful. And so the person can't get the reassurance that they're looking for their what if thoughts. And the more that they ask for reassurance and the more that this person is unable to guarantee what they're hoping to hear, the more that the worry and panic continues and continues and continues. And so it gets bigger and bigger and bigger. And even if, let's say, the medical team could provide reassurance that things are looking good, things are tracking as we expect, that reassurance is only likely to last for a brief period of time, because the what if thought can always change. So in this case, what if the transplant hasn't worked? What if it stops working, or what if, it doesn't engraft down the track? All of these kinds of things. So that what if statement can always kind of morph into something else. And unless we find a way to break this cycle, we just continue to feel worried. So some ways that we might try and break the cycle when we're starting to feel this way is to identify what is the type of worry that we're experiencing. So in the previous slide, the what if thought we might refer to as a catastrophizing thought. So catastrophizing just means that you have a sense that something bad can and will happen. And the more you think about it, the more convincing that thought becomes. This is going to be bad. This is going to be bad, right? That's a catastrophizing thought. Future telling refers to when we try to predict what happens in the future. And when we're facing a lot of uncertainty, this tends to be a common thing that can happen for us, that we try and predict what might happen for me down there. Or we might also fall into the trap of trying to mind read. So we might predict, for example, if maybe our doctors come in and they have a blank look on their face, we might look at that and think they're going to give me bad news today. But we don't actually know. We've just interpreted something on their face and we're trying to ascribe a meaning to that thing. That's what we would call mind reading. And in my previous example, there's kind of a way that we can, once we've identified the type of worry, we might want to map it out and see how these thoughts might be influencing the things that we're feeling, and then what we feel called to do. Are we trying to seek reassurance? Are we Googling? Are we, becoming really withdrawn and not talking to anybody? What's happening to us when we're getting stuck in these cycles? And if it also feels difficult to break through the cycle of just thinking and thinking and thinking, you might like to try a strategy that's called worry time. So worry time involves allowing yourself 10 to 15 minutes every day for your brain just to run wild with all of the worry thoughts. It can worry as much as it like, imagine all the worst case scenarios. And then outside of this 15-minute window, that's the end of that. So you might like to set a timer if you want to try worry time so that your worry doesn't continue past that point. And if you find it hard to actually stop worrying after the timer goes off, you might need to say something to yourself to reinforce that that's the end of worry time for today. So you might say to yourself, I've had my worry time for today. That's tomorrow's worry time. I can't take from the bank of worry time that belongs to tomorrow. I only have 15 minutes for today. And we might have to do that multiple times. We might have to keep saying that to ourselves if the worries keep coming back. Scheduling pleasant activities after using worry time might also help us to redirect our attention to something more pleasant. So we might want to try, redirecting our attention to our favorite TV show or our movie or a book or some calming music. And that might just help us to shift away from the worries. And I'll also go into some other strategies for how to do that, including mindfulness. So CBT is great for dealing with the actual thoughts. Mindfulness is maybe helpful for when there's a lot of uncertainty, if we feel like we're doing a lot of this, going into the past and thinking about things that happened that might have been distressing, or trying to predict the future. If we find ourselves doing that, it might actually be more helpful to try and come back into the present moment. So mindfulness is a practice that helps you to develop this skill set of being able to come back into the present moment and resist getting caught up in your thoughts. So it can consist of a number of different practices. It might involve breathing exercises, meditation, focusing on sensory experiences, and I'll go through some of those things in a bit more detail. But it helps by building your capacity to control your awareness. So as we repeatedly have practices where our mind might drift off, and we bring our mind back in whatever way we choose to do that, whether that's anchoring with our breath, or whether that's using a sensory focus. Every time our mind goes off and we bring it back, we're kind of flexing the muscle of mindfulness. So we're building our capacity to say, okay, my mind's gone somewhere, but I can come back here. And I don't have to get carried off in that thought process. I don't have to go down the rabbit hole with all of my what ifs. I can just come back here to the present moment, to what's happening right now. And that can help reduce the activation in our nervous system. So it can actually help us to feel more relaxed. And when we pair that with breathing, there's also some physiology that can help us to feel less stressed, as well as less busy in our mind. And we might also use mindfulness to help us accept things that can't be changed or altered. We might be able to focus more on just being, rather than feeling like we have to be doing or thinking all the time. It turns out sometimes we can just be, which in our busy world, there's not a lot of space for that, but mindfulness does actually create a place where we can do that. And relaxation in the context of transplant, and using mindfulness for relaxation, can also assist with managing nausea, pain, or anxiety. So, as I mentioned, there's a few different ways that you might try and build your mindfulness practice if you don't have one already. In a moment, I'll take us through a diaphragmatic breathing exercise, so you have an idea of how this works. But another strategy that's really common in mindfulness practice is to learn to watch your thoughts as though they're clouds in the sky, and they're just moving in and out of your conscious awareness. So instead of being caught up in them and giving your thoughts a lot of power, you're just watching them drift in and out of your mind, just coming in and going out. And you might even, relate to those thoughts like, I can see that thought. That thought isn't necessarily what I have to grab and worry about in this moment and go down the rabbit hole with. It's just something that's occurring in my mind. And when we do that, it's surprising how much our thoughts can just kind of move through our minds and float out the other side. If that's not for you, you might prefer to try something a bit more sensory. So the 5, 4, 3, 2, 1 method involves using your senses to become present within your environment. So you can do that through naming 5 things that you can see. And if you're playing at home, you can even do this as I'm talking. You can look around your room and name 5 things you can see, 4 things that you can touch, 3 things that you can hear, which probably at the moment is just my voice, but you might be able to hear some background sounds, maybe some cars, maybe some people walking around your home. So that's all a part of mindfulness too, that you're paying attention to what's around you, what's occurring. There might be 2 things that you can smell, if you have any nice smells around, a candle or anything like that on your desk, or even just if you're wearing a perfume, and 1 thing that you can taste. So interacting with your senses really just helps you to ground down in your body and just come back to here. In this moment, what am I experiencing? I'm not worrying about what's going on up in my head. I'm just going to come back into my body through using a strategy like this. And if it's difficult to focus, there are a lot of great free meditation apps and tracks available on YouTube that can guide you through mindfulness practice as well. So I think in Australia, we've got Smiling Mind, which is a great free one. There's a number of paid ones as well if you're super interested and want to invest a little bit in it. And just a little note on meditation specifically, that if you experience severe mental health conditions or dissociation, it might be a good idea to check with your psychologist or your psychiatrist before attempting meditation, because in those circumstances, it might not always be helpful. Or it may be, but it's just important to know that it could exacerbate some of the symptoms that people experience with those conditions. So this is a brief invitation to practice with me to do some diaphragmatic breathing, some belly breathing. Before we get into the breathing exercise, I'll just give you a little bit of information about diaphragmatic breathing and why it's helpful. So when we're feeling stressed and anxious, our body tends to activate a system called the fight-flight system. So it's preparing us to get ready to fight off the threat that our brain has perceived, or we're getting ready to run away, basically. So there's a whole lot of energy that's being generated in this process, and it starts to feel very agitating, very restless. We start to have all of these really active thoughts. And what starts to happen with our breathing is that it tends to speed up, and we tend to breathe quite shallowly into our chest. And we might like to think about anxiety or stress or panic like it's a fire. And the more quickly that we breathe, the more we're fanning the flames of the fire. So the anxiety is getting bigger and bigger and bigger the more that we're breathing quickly, to the point where if we breathe so quickly that we hyperventilate, we might experience a panic attack, because that's what panic attacks are. They're hyperventilation. So if we can do the opposite, we can activate a system in the body called the parasympathetic nervous system. And that's responsible for helping us relax and calm down after stressful events. So kind of doing a breathing exercise is essentially like a bit like hacking our body a little bit. You know, we're kind of flicking the manual override switch, and we're saying to our body, now's the time to be calm. And we can do that through breathing long exhales and also slow breaths down into our belly. And the thing with diaphragmatic or belly breathing is it's actually harder to breathe more quickly, and it's harder to take shallow breaths when our breath has to go all the way down into our belly and come back up. That naturally just slows us down a little bit. And we can also integrate some of our mindfulness techniques in with a belly breathing exercise. So as we're breathing, our mind might tend to naturally wander off. We might think about all the things we have to do after this. We might think about all the things that were worrying us before we do the breathing exercise. And we can actually use our breath as an anchor to continuously notice, oh, okay, my brain's done it again. It's gone off. It's thinking about all of my worries. Let me see how I can bring this back to the breathing that I'm doing. So to try and consolidate this breathing practice, if it is something that interests you, I'd recommend trying to develop this skill when you don't already feel stressed or anxious, because it makes it harder to learn. And a really good time to practice it might be before bed, because it can help you relax and get ready for sleep. And also give your brain something to focus on that might be different from all the thoughts that might be going on at bedtime. So if you'd like to join me, if you feel comfortable, please take a moment to sort of make sure that you're in a comfortable position in your seat. I'm going to get comfy too. And before we get started, if you feel lightheaded at any time during the practice, you can just stop and return to your usual breathing. So to learn diaphragmatic breathing, it's helpful to see first where you're usually breathing, into your chest or into your belly. So it can be helpful to place one hand up on your upper chest and one hand on the upper part of your belly. So just where your rib cage meets your belly, that's where you want to put your other hand. And for a few moments, just breathe as usual and try to notice where your breath is going into. Is it mainly going into the top of your chest, or do you feel like it's going down into your belly? So just take a few breaths to notice. And now we're going to try and see if we can do some diaphragmatic breathing. So particularly if you feel like your breathing is going to your upper chest, I want you to see how much you can fill your belly up with air. So just aim to make your belly fill up as much as possible as you breathe in. And you should notice as you breathe in that the hand that's on your belly moves outwards. So as you breathe in, your belly should expand, your hand should move out, and as you breathe out, your belly should contract and your hand should move further back in towards your body. So just try and see if you can take a few breaths now to really expand your belly and contract it. And we might even try counting 5 breaths like this. So breathing in for 1 and breathing out. And on your out breath, you might like to try elongating your out breath as much as you can and trying to really slow it down. So now we're going to breathe in for 2. And we're going to breathe out again. And we're going to breathe in for 3. And breathe out again. And as I'm talking, your brain might be wandering off in all sorts of different directions. You might be thinking, oh my gosh, when is Phoebe going to stop doing this breathing exercise with me? You might be thinking about, am I doing this properly? Just bring your mind back to the sensation of your belly filling up with air. So we'll do one more, breathing in and out. Just bringing your mind back to those sensations. So with all of these toolkits, right, we can kind of use them in tandem with one another. So the mindfulness can be put together with the CBT, and so can self-compassion. So with all of the constant readjustment and the changes that transplant brings to your usual life, it's hard sometimes to feel like it's sort of acceptable to spend a lot of time just resting, just being. As I mentioned earlier, it can be hard to adjust to receiving care from medical staff or being in the hospital, being apart from loved ones. And sometimes when we have all of these difficult experiences, we can become critical of ourselves or feel like we're not doing enough. And sometimes we start to talk to ourselves in ways that aren't particularly kind, or that we wouldn't really, speak to our friends in that way. And so self-compassion can help with this through helping you develop a more kind relationship and understanding with yourself without becoming self-critical or blaming. And it sort of takes the stance that suffering and experiencing challenges are just a part of the human experience. So to try and develop some of these ways of being more compassionate to ourselves, we might try recognizing negative or self-critical thoughts as they come up. We might try and do that through journaling and identifying these moments of suffering and the thoughts that come up with them, and try and see them just as symptoms of the suffering that we're experiencing, rather than taking them on as being a true representation of who we are in that moment when we're suffering. We might also notice when shoulds are coming up. So sometimes we have these rules and expectations for ourselves that we can hold in quite rigid and inflexible ways. And we can feel like we should do something. We should be being more active. We should be moving more. I should be doing more to help myself recover from transplant. And actually, these shoulds sometimes just compound the problem. They don't actually help us to feel more motivated. They can feel convincing that they're helping us to feel more motivated, but actually we tend to feel worse about ourselves. So we might try and think about, instead of treating myself like this, how would I treat a good friend? And I'll very briefly go through some ways that you might want to work on treating yourself like a good friend. But you also might want to work on this through being compassionate towards yourself about the limitations that you might experience, or the things that you're not able to do if you're feeling unwell. You might need to set some compassionate boundaries with people, or feel comfortable with saying no in ways that are kind and compassionate. Saying no doesn't always have to be harsh or feel like we're shutting people down. We might find compassionate ways of communicating that we're limited in what we can do. So we might say something like, I really appreciate your offer to spend some time with me today, but I'm not really feeling that up to it. And I hope that we can spend some more time together when I'm feeling better. And I'll get in touch with you when I feel a little bit better. So if you are someone who tends to talk to yourself in a fairly unkind way when things are getting tough, like calling yourself an idiot or lazy, you might ask yourself, would I speak this way to one of my friends? You might try identifying feelings that are coming up with this self-talk. You might want to write them down in your journal. You might not. You might want to just label them in your mind. But you might also recognize that this self-talk is just evidence of your suffering. And you might want to be receptive to yourself in this suffering by acknowledging, this is really tough right now. I'm speaking to myself in this way because I'm having a hard time. And I'm just going to place a hand on my chest, or place a hand on my hand, just give myself a little pat, to just kind of recognize that actually I'm just having a tough moment right now. And that's okay, because we all have tough moments sometimes. And what would I do? What would I say to a good friend who is experiencing what I'm going through right now? How would I be compassionate to them? That can be a powerful way of reframing how you're treating yourself. So in addition to that, there's also a lot of assistance that you might be able to have while you're in the hospital if you're struggling with any aspect of your transplant. If you're finding it hard to communicate to your medical team, you might like to keep a pen and paper by your bed to write down any questions. And don't be afraid to clarify anything that feels unclear or confusing with your medical team. You might want to have support people present for important medical reviews or appointments after transplant. They can help you remember some of the things that are being said, and also help to digest some of the information afterwards. And if you're feeling upset or frustrated during treatment, it might be helpful to communicate your feelings to the team. So using some of the strategies from today's presentation, like the slow breathing or the 5-4-3-2-1 method, that might help you just to release some of the tension, some of the stress about how you're feeling, to help you to communicate to the team. These are my worries, here are my concerns, and how can we work together to find a solution that's going to help me feel more supported or get the help that I need. There's also a number of allied health professionals that can help you when you're in hospital. Dietitians can help if you have difficulties with your appetite, your nausea, struggling with eating. Physios and OTs can help you with building back your strength or any balance that you might lose after transplant. Social workers can provide support and information around managing the financial, occupational, or family stresses that you might experience. Psychologists can help you apply some of the strategies that I've talked about or process some of the experiences that you're having of transplant, or help you deal with anything like sleeping issues or pain. So psychologists can provide a more tailored version of what I've given you tonight to really suit whatever it is that you're experiencing at that moment. Psychiatrists can provide medication reviews if that's something that you feel you might need to help you cope. And they can also help to assess if there's anything physiological that might be impacting how you're feeling mentally. And lastly, spiritual care can offer compassion, emotional support, or arrange spiritual guidance and support within your denomination to help you cope. Just a little note that allied health resources might differ depending on what hospital you're receiving your transplant through, but it's always a good thing to ask your treatment team and to see what's available if you do need support. So after transplant, there's also a number of things that might impact how you're feeling, including treatment fatigue, processing your experiences of transplant. You might be thinking about what you experienced a little bit more after you've had some time to recover. You might be thinking about returning to work, socializing, or study. And you might want to be speaking with your treatment team to help you set some expectations about that, and help you come up with a way to pace yourself to try and return to things gradually, because taking on too many responsibilities might become overwhelming if you're feeling exhausted. And you might become worried that transplant won't be successful, or that you'll develop another health condition, such as the graft versus host disease. So the long-term side effects of treatment may be challenging for some people. That's not in any way a guarantee that any of those things will happen for you. Not everyone develops GVHD or experiences it in the same way. But for those who do develop it, it can be important to work with a multidisciplinary team, including mental health supports, to help you adjust and learn to live with some of those impacts. And I'm sorry, I'm trying to speed up because I know we're kind of running thin on time. So here's just a few points for family, friends, and caregivers. So just a note that transplant is also stressful and can be demanding for other members of the family. The uncertainty that's happening for your loved one is also something that you're going to be unavoidably exposed to as well. And everyone copes in their own unique way with transplant. Some people might want to talk about it. Other people won't want to talk about it at all. there's no right way of how someone should be coping with transplant. So you might want to ask your loved one directly about their support preferences and assure them that you're there to help understand them and support them in the best way you can. And if you feel like there's more that you wish you could do to help your loved one, or you feel like you want to fix or control the things that they're struggling with, please don't underestimate that sometimes just being there with them, being present, appreciating the time that you have with them really can make a difference to their experience, and may just be what they need in that moment. And it's important to acknowledge that your life also might change considerably in relation to your loved one's transplant. So taking the time to care for yourself helps you to have the capacity and the resources to show up for the person that you love. So reaching out to your own support system, and also engaging with any professional supports if that's what you need, to try and help you continue to get enough sleep, eat the food that makes you feel good, and continue with your own exercising and engaging with your friends too. All of that's very important to try and continue. So just some take-home tips. Obviously, from everything we've talked about tonight, transplant can be highly stressful and impactful. And just like you're going to be aiming to help your physical recovery after transplant, taking steps to help with your mental health recovery is equally as important. And finding the strategies that resonate with you for managing some of these challenges is, I think, a part of the process. So hopefully I've given you some little roads to sort of explore with yourself tonight. If any of these things piqued your interest, there is a wealth of resources out there for you to access. So, please feel free to have a look yourself, or talk about those things with a psychologist that you might be working with. Okay, I've taken us right up to the time, but I'm happy to stick around and be with some questions. I'm sorry.
Oh, no, don't apologize, Phoebe. It was absolutely fantastic, and I'm sure people are feeling like their cup is full of information. So, look, there aren't any questions in the chat, but I have a question for you. Given that generally there is a lead up to transplant, so people undergo a pre-transplant workup, and there's a bit of time getting the logistics and an opportunity for people to get healthier prior to transplant. How important is it to practice the techniques that you've described tonight to feel like you're comfortable with them during the transplant?
Yeah. I mean, I think it's the best case scenario, really, if you can practice some of these things. And as I say, it's a toolkit, right? So you want to have the right tool for the job. And we don't really know what's going to come up for people individually in their transplant. So hopefully some of the strategies, whether someone's more inclined to go about it in a more cognitive way, maybe some of the CBT strategies will be helpful if you feel more inclined to go about it in a more mindful or compassionate way. Really just delving into those things before transplant happens can help you to feel like, okay, I have some things in my toolkit that I can bring out if things start to get a bit tough for me while I'm in there, because you're really tired and it's hard to deal with hospital. It can feel quite overwhelming. So if you've already kind of preloaded your toolkit, so to speak, you can take that in with you when you go.
Yeah, great. No, that's fantastic. Thanks, Phoebe. So there's lots and lots of gratitude and thanks to you in the chat. A reminder, and look, I'll hand back over to Ange and she'll talk a little bit more about Arrow, but there are a lot of resources on the Arrow website to help support patients and families, and Ange also does a great job of facilitating Transplant Tribe, which is support network for patients as well. So, but look, Phoebe, on behalf of Arrow and our wonderful audience tonight, thank you very, very much. We'll definitely be inviting you back for part 2. Thanks again, and I'll hand back over to Ange.
Thanks, Yvonne. And yeah, thank you so much, Phoebe. It was really fantastic. I know I say this all the time, but I just get so much out of these webinars, and I'm sure our audience does in entirety. And it just makes me think that toolkit, I can envisage an actual toolkit for patients, like quite literally, that, we could you could put cue cards and all sorts of things in it. I think it's such a beautiful way of thinking about how to deal with the psychological impacts. So I really loved that, and I loved all your tips. So to our audience, yeah, thank you so much for coming along and joining us tonight. I know that there was a lot of thank yous, and people have got a lot out of tonight. As Yvonne said, we do have a support group that I run once a month called Transplant Tribe, and it is for people both pre and post transplant. And we have a really wonderful group. It's a really supportive group, and we do feel like it's becoming just a really lovely place to be on the third Thursday of every month. So if you're interested, please do contact us. We do also continue to have these webinars throughout the year. It's the last one, of course, for our financial year, but we've got a great number of and some great topics coming up for 2026-27, and definitely would love to keep exploring this subject. So no doubt we'll see Phoebe again on our screens. We do have a short survey at the end of tonight's webinar. It's really helpful for us if you can jump on and do that survey. It's completely anonymous, but it helps us hugely in planning for our future webinars. It also gives us ideas on other topics that our patients and families are interested in learning about. So if you can jump onto that, please do. Once again, if anything's come up from tonight's webinar that has triggered anything for you, and you do feel like you need to speak to anybody, please reach out to your treating healthcare team. We always say that your GP is also a really great protocol. Head to your GP, and they can always steer you in the right direction if you're out of if you're no longer actually an inpatient and only seeing your team sort of once a year at this stage. But yeah, please take care, everybody. And thanks again, Phoebe and Yvonne. You've been amazing tonight. Take care.
Thanks, everyone. Bye.
Bye, everyone. Thank you.